Welcome, everyone, and thank you for joining us at Assisi for 30 minutes of feline education on feline OA. Our presenter this evening is Dr. Denis. She is a full-time clinician at the Charing Cross Cat Clinic in Brantford, Ontario. In 1999, she completed her Doctor of Veterinary Medicine degree at the Ontario Veterinary College. Dr. Denis has been certified with the American Board of Veterinary Practitioners in the specialty of feline practice since 2013. She is the 2020 president for the American Association of Feline Practitioners and is proudly one of the 6 Canadian feline specialist members of Cat Healthy. She is a consultant on the Veterinary Information Network in feline internal medicine. We welcome Dr. Denis.
Thank you so much. I'm really excited to be here this evening with everyone. This is a unique experience for me. I do a lot of lecturing, but it's really lovely to be able to share my presentation with some loving cat owners, as it's always a different thing when you're the loving cat owner and not necessarily a veterinarian. So I'm looking forward to this evening. So I just want to have a little disclaimer before I get started that some of the things that I'll be talking about in the next 30 minutes are views and opinions of mine based on my experience, and they don't necessarily reflect those of our sponsor. So if I'm discussing some treatments that I might suggest you discuss with your veterinarian, those are based on my own experience and opinion. We do mention some other companies' names and products, and those are the property of their respective owners. And I will note in some cases that not all the products that we discuss are actually approved by license for use in cats. And that would be a conversation that you would need to have with your veterinarian when discussing treatments. So I'd just like to take another second to say thank you to our sponsor, Assisi Animal Health. It is always lovely to have companies to work with that are so dedicated to making sure cats have better quality of life. Both as young cats and also as they age, because so many things happen as they get into their senior golden years. So thank you, Assisi. So I have 4 main objectives for this evening's presentation. We're first going to talk about feline arthritis in terms of what it is. And then we're going to delve into whether or not your cat actually has arthritis. How can you know if your cat has arthritis? We have a sore joint. We can tell our doctor, my elbow hurts and it makes this noise when I move it, and when I do this, it hurts. But our cats are not quite so forthcoming about things that bother them, so it can be really challenging. We are then going to talk about treatments and how you can work with your veterinarian to find the appropriate care for your cat. And then we're going to delve into some ideas about things that you can do at home that are pretty easy to accommodate your cat's environment to make it more pleasant when they have osteoarthritic pain. So let's have a look at what is feline arthritis. So the common or proper scientific term for arthritis in general is degenerative joint disease. And it's kind of like an umbrella term. And I tend to use this a little more whenever I can, because it actually encompasses a number of different things that happen to us and our pets as they age. And most commonly in cats, 2 of those things under that degenerative joint disease umbrella are going to be osteoarthritis, which we've already started speaking about. And that really is a degeneration of cartilage in the joints. And cartilage is the soft padding that lines the inside of the joints, so that when the animal is moving and the joints are moving, they bounce against each other, and it's a soft padding, and there's fluid in there as well to protect the joints from damage. But as osteoarthritis progresses, we start to see changes in those cartilage layers. They degenerate, and then we get pain and we get inflammation. The other less commonly known problem that cats get, and is also a part of degenerative joint disease associated with age, is a condition called spondylosis. And you can see in the bottom right picture, what we have there are bony protrusions that form, and they lead to bridging of the vertebrae along the spinal column, so the vertebral column or the cat's back. And you can see in that bottom right picture that there's an arch of bone underneath the vertebrae that's starting to bridge that cat's back, and that makes a painful situation for that cat, because mobility is no longer an easy thing. So their spine is supposed to be very fluid when you move, but if you have things starting to fuse together, then that can be quite painful. So where do our cats get degenerative joint disease, and where do they get osteoarthritis? Where do they get spondylosis? Well, as we can see from this, it's pretty much in every possible joint. And the most common ones that we know occur in cats, based on some research over the years, are the hips, as well as the ankles, or what we call the tarsus in our veterinary lingo, or ankle is easier to remember, and then also in their knee or stifle. So those are pretty common. We also see it in the elbow and the shoulder and in their wrists. Now, I've pointed out in this diagram the backbone, again, to remind us that we do have problems with spondylosis, but cats can also get osteoarthritis along their vertebral column or their backbone, so they have potential for two different things to happen there. So we do know that most affected cats, most cats that have degenerative joint disease are going to be older. So they're usually greater than 10 years of age. And that sort of increases as they get older. But we have some data to show that cats as young as 6 months of age can have changes in their joints based on x-rays that show osteoarthritis and degenerative joint disease. As they get older, we know that risk increases. So if you have cats at home that are 7, 8, 9, every year that goes by, the chances that they have some arthritis in at least one or more joints is going to increase. We do know also that if they have arthritis in, say, one elbow, then they're most likely to have it in the other elbow as well. So it's a very common thing to find it in both joints in that cat. So knee and knee, ankle, ankle, so on and so forth. And we know that they do get more than one joint affected. So how are you going to know if your cat has arthritis? Like we talked about, it can be really challenging because cats are masters at hiding illness, right? We know even when in their adult years, if they get sick, sometimes it's really hard to tell. I mean, they just hide everything because it's instinctive for them to survive. So to show that they're in pain or discomfort, it's really not on their agenda. They want to keep everything looking great. So some of the signs that you might see at home that are evidence of what we call chronic or long-term pain would be things like the cat becoming grumpy when maybe they were happy-go-lucky before. You might notice that they're slowing down a bit when they move. They don't move as quickly. Some cats will develop a sudden dislike to being brushed where they used to like it before, or they might dislike brushing over a certain area. So for example, over their hips. Maybe you used to be able to trim your cat's nails really well and easily, and now all of a sudden they don't want you to do that anymore. And then again, some cats won't like petting where they used to. You might notice really subtle things like your cat is interacting differently with your family. So I've had clients say to me, you know, they don't come out and sit with us when we watch TV at night as much as they used to. Or I've actually heard the opposite, where all of a sudden the cats are more needy and they're sitting on your lap more often where they weren't there before. They may interact with other pets in the household differently too. So where they got along with other pets, they may no longer. You might see things like missing the litter box. So house soiling, accidents outside of the edge of the litter box, accidents elsewhere in the house. Maybe they can't jump as high, or they've just changed their jumping behaviors. So some cats that maybe used to jump on the kitchen counter right from the kitchen floor are now using a chair as an intermediate step to get up to that counter. So they'll still go up to the counter, but they're using another step in the middle because they really don't want to jump that high. A lot of times we'll see changes in grooming. So you can see either spectrum of that. You might see that your cat is grooming excessively, as you see in this picture here, where this cat has bad arthritis in its ankle. Or some cats will groom less because they're sore and they don't really want to move around to groom. A lot of my clients will say, oh, well, a cat's not limping, so they can't be sore, they probably don't have arthritis. But in all of the studies that have been done over the last 10 to 15 years, lameness and limping is the least common clinical sign. So don't look for that as a clinical sign of arthritis in your cats. If you see lameness, I mean, obviously that's important, but don't expect it and don't use that as your main criteria for trying to figure out if your cat has arthritis. You really need to look for these more subtle signs that we're talking about here. We have some great questionnaires available that are really simple for you to answer and go through. And I would urge you, if you have a senior cat, to get a questionnaire like this from your veterinarian or a questionnaire online, and to start a little diary for your cat, you know, and do it maybe twice a year or once a year so that you can look back and see, okay, how has this changed? You know, maybe this year the cat's jumping normally and jumping up and down and using the stairs normally, but then in a couple of years you notice that there's a trend to the point where the cat's not doing as many of those things as normally as he used to. You might notice some really subtle signs in the way your cat sleeps. So in these pictures, you can see that our clinic cat Cosmo, the black guy on the bottom here, the black cat, has a really funny way of laying. He always laid with his arms stuck out because he had really bad arthritis in his elbows. So your cat's no longer curling up in a ball or stretching out in a normal, natural, relaxed way like they used to. That can be evidence. And you might also notice that your cat is sleeping in unusual locations and they're sleeping more. And that's always a difficult thing to figure out because we all know cats sleep a lot. They sleep about 15 hours a day, sometimes longer. And so you should be aware of what your cat's normal sleeping patterns are and adjust accordingly, kind of start to notice if maybe they used to sleep 15 hours a day and now they're sleeping way longer. That's also a sign. They might be slow moving upstairs. And I have this little video of another one of our clinic cats, Marty. And you can just kind of get a sense of, Marty's he was in a cage all night. He has had his breakfast and he's usually a very interactive cat and everybody's upstairs in my clinic. But he's kind of like, well, I really want to see everyone and they might have treats for me, but I don't want to rush up the stairs. And you can see how he's taking the steps very slowly and he's very careful about his movements. Here are some cases of cats that have arthritis that have been not grooming as well. So the cases on the left, the two pictures show a cat with a lot of dander. She's not able to reach her back area because she's so arthritic. So she's starting to develop some mats and dander, that white flaky stuff in her back. And then the second cat on the left, you'll see is kind of looking really dull coated and her coat looks a bit, I don't want to say gnarly. It's looking like it's going to start matting soon. It's not well groomed. And again, this cat had arthritis pretty bad. And then on the other side of this, we have over grooming. So this other patients were grooming excessively because they have painful joints and they're somehow trying to alleviate that pain by grooming themselves. And obviously we know that's not going to help them, but they don't know that. And so they start to really go crazy barbering off their fur. This is a patient of mine who is a good example of how pain can lead to excess grooming. So this patient had blood in her urine, but she was also showing signs of extra hair loss on her arms and her legs, as well as her belly. And when we took x-rays, I've got these things circled and arrowed. In the red circle, that's her bladder, and that brighter circle in the middle is a bladder stone. So she had a really bad issue with her bladder, so she was over grooming her belly. And then on the arrows, that's a picture of her knee, and there's a lot of bone inside the knee joint that shouldn't be there. So she has very bad degenerative joint disease. So she needed surgery to remove her stone, which we did, and we started her on pain medicine for her degenerative joint disease. And a few months later, she came back, and this is what her fur is like now. So for years now, she's had no more stones because she's on a special diet and she's on pain medicine and arthritis treatments. And this is what her fur looks like now. So just something to think about if your cat's grooming a lot. How is your vet going to diagnose this? Well, you guys are so key in providing help to your veterinarian because the history that you provide to us when you come in and all those questions and things that we observe at home and how our cats are behaving, those things are key information for your veterinarian. Your veterinarian is also going to perform a physical examination and possibly an orthopedic examination to try and isolate down which joints might be painful or abnormal. Your veterinarian might suggest x-rays because that will really help, as we saw in the last patient, to determine which joints are affected and how badly. And then we're going to come into a response to treatment. So sometimes if we think a cat has arthritis or degenerative joint disease, when we treat them and if they seem to feel better or some of the clinical signs that you're observing at home go away, then we have a pretty good suspicion and confirmation that we are treating arthritis and we are helping your cat's pain. So what can we do? We have so many lovely things that we have available to us now. And it's really our goal with any kind of treatment for cats for arthritis is to reduce the pain, number one. And that also means reducing inflammation because inflammation in those joints where the cartilage is damaged is what causes pain. If we can improve your cat's joint function and how mobile your cat is and the mobility of that joint, that's super. And if we can slow the disease process, that's even better because then we know we can keep them happier and safer for longer. So I constructed this wheel because this wheel really shows how we really want balanced care. So some patients may be surgical candidates. That's not as common with degenerative joint disease, but there are some situations. We can look at nutrition options. We have things like nutraceuticals, pharmaceuticals, so drugs, environmental modification, which I'm going to talk to you about shortly, and things like physiotherapy, laser, chiropractic, and also treatments like the Assisi loop, which we're going to look into as well. So your veterinarian has a lot of products available that help in terms of nutrition for your cat with arthritis. And we know that cats, as they get older, they may gain a little weight. So one of the first things you're going to want to work with your veterinary team is weight loss if it's needed. So if your cat's body condition is too high, taking some of that weight off is a really good idea. So we want to do that in a controlled fashion with your veterinary team. Now, yes, we want to use diets that help their arthritis, but we also have to take into consideration if your cat has kidney disease or diabetes. So we don't want to just choose that diet based on arthritis. We may have to choose diets that help with both kidney disease and arthritis. So there are diets available for us to do that. We just have to make sure we plan appropriately. A lot of these diets will contain ingredients such as glucosamine, chondroitin, green lip mussel extract, and omega-3 fatty acids. So some of those are some of the things that we know will assist these cats. And a lot of these diets are also senior-related diets, so they will have other ingredients that promote good health overall in your senior cat. There are an unlimited number of nutraceuticals available, and you might read online about all kinds of different things on that are available. We talked a bit about some of the things that go into the food. We have cosequin, we have things like duralactin, omega-3 fatty acid supplements, glucosamine, chondroitin. I mean, it's really kind of endless and can be overwhelming. And really, when I'm looking at these things, I'm asking myself, what evidence do we have? Do we have any published studies that actually show there's some benefit? So we do have at least one study in dogs that showed benefit when they were treated with omega-3 fatty acids. And that makes a lot of sense because omega-3 fatty acids can be anti-inflammatory. So that helps reduce pain. And then we have other products like microlactin, where we do have some studies that have shown improvement in orthopedic scores in geriatric arthritic dogs. So you just want to be careful what you're picking out there online and maybe ask your veterinarian for advice. This is another product that some veterinarians will use. These are injectable chondroprotectants. So these are injectable items that will actually help to improve cartilage health. And we talked about that cartilage being a cushion. And if we can help replenish that cartilage, then we're going to improve that patient's health. These are by prescription only. And again, this is something that you want to discuss with your veterinarian. And they're administered, as I said, by injection under the skin. They are not licensed in cats. They are used a lot, and we have this anecdotal information. So a lot of people feel that it helps cats in their arthritis, but we don't have any published studies. So always good to talk to your veterinarian about this stuff. Like, don't go and start using these things without their assistance. So let's talk about the Assisi loop. So the Assisi loop is called what we would consider a non-pharmaceutical anti-inflammatory device. So this is great. You know, sometimes we want to avoid using medications, or we want to try something that's a little more holistic and not involving anything invasive. And so what the Assisi loop is targeted pulsed electromagnetic field. And so it enhances nitric oxide production, and that will help us to regulate inflammation. And it also promotes healing. We also have information to show that electrical currents can increase new bone formation and healing. So we're going to have that as well to consider. Now you can see in the lower left what the Assisi loop looks like. It's a simple little circle with a tiny little device on it, and it does emit the electromagnetic field out 10 inches on either side, or 25 centimeters. And then for the cat, we're going to get the 10-inch diameter loop, and I'll show you a picture in the next slide on what that looks like. So here's a kitty cat getting his Assisi loop treatment. And we have a couple of options. I'm going to show you what they have available for us to use. And I've been using this manual one in my one arthritic cat. She has had a broken pelvis as a kitten. And she's a pretty lazy cat, so it's pretty easy. She'll sit for 15 minutes, no problem, with the Assisi loop over her pelvis. We don't need a timer. If your cat's having a snooze, you can lay that on them, and then it shuts off after 15 minutes. We have some that will do the auto cycle. So there's pre-programmed treatments every 2 hours, and that manages ongoing acute and or chronic issues. And again, as I mentioned, there's 2 different sizes, and for kitties, we're most likely going to be picking that 10-centimeter one. And again, it's a comfortable applicator coil. So it's easy to position. It's very light. It doesn't weigh much. It doesn't make any noise. So it's not frightening to your cat either. There are some really neat things available as well, including the Assisi Loop Lounge, which comes with a Sleepy Pod carrier. So this is a really good quality carrier that's also good for use in airlines or if you're traveling, which none of us are really doing right now. And again, it's rechargeable at home, or you can use it on the go. And then in the lower right picture, you can see the Buddy Rest, which is another option if your cat likes to sleep on something like this, but maybe not inside of an enclosed space like the carrier. So if we're talking to our veterinarian and we're interested in things like nutraceuticals and the Assisi Loop, those are definitely things we want to discuss. And because of that balanced treatment wheel, we also may want to consider some pain medication. And the thing that you want to make use of your veterinary team for is knowing whether these things are safe, are they licensed, can I use them long term, what are the side effects, do I need to worry about anything? There are a lot of different drugs available for pain medication, or what we call analgesia. And again, they should be done under the direction of your veterinarian. So none of these medications should ever be used without your veterinarian's help. And we do have studies to show some of these drugs are safe in our cats, even cats with kidney disease, certain drugs in these pictures, for example, and also that they show improvement in cats with degenerative joint disease, pain, and improve their mobility. So definitely something that you want to look at with your veterinarian. Some of these products are licensed for use. Some of them are not. Some of them are licensed for use. For me here in Canada, I can use Onsior for arthritis pain, but it isn't licensed for use in the US for that purpose. So there's a lot of different things that you need to consider, and that's where your veterinary professional comes in. So Marty, who doesn't like going up the stairs much, even though there's lots of fun things upstairs, we have him on a number of pain medications, and he has the senior diet as well. And you can see how much better he is when he's on all of this combination. Again, this is balanced care, right? So he's much more playful, much more active. So we've talked about what you can do in conjunction with your veterinary team, but let's talk about what you can do at home. And this gets into that environmental care that is so important. And we always talk about resources now for our cats, and resources in environmental management are important from kittenhood till cats are geriatric. But when they're arthritic or have degenerative joint disease, it's that much more important. And the other thing is that your older cat can get cognitive issues where they start to have not senility, but they have functions that are diminishing in their brain abilities. So if we're doing things like physical and mental stimulation, we're keeping their joints moving, we're keeping those joints fluid and healthier, but we're also keeping their brain healthy, which again will help them live longer lives and better quality lives. So you can see a lot of examples in here of feeding puzzles. Instead of just putting our cat's food in a bowl and say, here you go, eat the food, that's really boring. Our cats are hunters. So if we can do things like a do-it-yourself in the bottom right corner with the toilet paper rolls and plastic containers stuck to a cardboard, or you can get fancy and buy stuff online like the No Bowl or some of these other things, your cats are gonna actually have better mental stimulation and they'll be a little more active. So this really does help our senior cats. And this is Marty again, and not all cats want to play with these feeding balls. We have 3 clinic cats, and the other 2 could care less about this feeding ball. But Marty was very interested in the feeding ball, and he got his dental kibble in that ball every day. And it was just something, again, to keep him thinking, because he has to roll the ball to get the food out, and then also to keep him active. Playtime is really important, so find out what your cat likes and do some activities with them. If they like rolling around in tubes, if they like playing on an iPad, we have a lot of different apps for cats that have games, and cats are pretty good at games on the iPad. It's pretty interesting. And even some cats are really interested in doing agility. So you can find all this stuff online. You can learn how to train your cats. They're pretty smart. So it just keeps them moving and it keeps them thinking. For your senior cat's going to need to rest a lot, right? We said they're probably going to sleep more. Even if we're managing their pain very well, they may want to sleep more. We want them to have lots of options for sleeping, especially if there's more than one cat in the house. So you don't want to have just one place to sleep somewhere in the house where they have to go far. They want lots of soft spots, blankets, cat scratch posts, little cat bags, cat tents, and then maybe just some blankets on your couch when you're not using the couch during the day, so they have something cozy to lay on. It's important that our cats have things to scratch on, and this is doubly important for our seniors because their nails start to get really thick as they get older, and so it's harder for them to shed the caps off of their nails. But then you also consider the fact that they will have degenerative joint disease and osteoarthritis, and so they're less likely to want to stretch out and scratch if it's not an ideal kind of place to scratch. So we want to make sure they have lots of options. We know that senior cats, based on some studies, prefer carpet to scratch on, but it is very good to offer them lots of different surfaces like carpet and sisal rope and tree bark for them to try out whatever the heck they want to use. Most importantly, improving access for our cats at home. So if it's hard for your cat to get on your bed, but your cat likes to sleep with you at night, then get a ramp or get some stairs or put a little stool beside the bed so that it's easier for your cat to jump up and down and they can still continue to do their regular routine things and interact with you the way they always have. Sometimes night lights are helpful for our cats, and you want to make sure that all of their resources are easy to access. So if your litter box is way down in the basement and you sleep on the second floor, you probably need to add some litter boxes on the different levels in your house so your cat doesn't have to walk a really long way with his arthritic joints to get to the litter box. You'll reduce the risk of house soiling and you'll make him feel much better. When you're looking at litter box care, we want to stop using those really high-walled litter boxes. We want low-walled litter boxes that the cats can just stroll right into so they don't have to hurt their joints when they're moving into the box. You want to keep care of that litter box, so you should be scooping it daily and making sure it's clean and using unscented clumping litter so the smells don't hurt their nose. We should have lots of litter boxes throughout the house, again, for access, and also if you have more than one cat in the house, you need to have at least one box per cat plus one. And keep in mind that this picture on the right that shows 3 litter boxes side by side, you see 3, your cat sees 1. So if you think you have 3 litter boxes and they're all side by side like that, your cat doesn't agree. So if you need to have multiple litter boxes because you have a lot of cats in the house, that's not going to cut it, and you're going to increase the risks of house soiling. So some things to consider about litter box care too. So remember, our treatment is going to be about balanced care. So again, some patients might need surgery, for example, with hip issues, but our diets are really important. There might be nutraceuticals like omega-3 fatty acids that are going to help. There may be some drugs that your veterinarian can prescribe. You can do a lot of environmental modification at home for your cat to make its life much more pleasant as it moves into its golden years. And then we can choose to use things like the Assisi loop that are going to help with that inflammation and help improve our cat's quality of life. So I'd just like to thank all of you for listening. And just in summary, degenerative joint disease is a lot more common than we think. It's often overlooked because our cats hide their pain. They are painful, but they're not going to tell us. So we need to look for all those really subtle signs at home. And then we need to talk to our veterinary care provider about a balanced approach and to continue to work with our veterinary care team as we move forward. So thank you again for your attention.